Hello everybody, Kylie Moss coming to you from the Centers for Vulvovaginal Disorders. I have been terrible about being on social media lately because of a couple of academic projects that have drawn my focus, but I am redoubling my efforts and I'm back today to talk to you about types of estrogen. The most common kind of estrogen that people encounter in drugs is ethinyl estradiol, and it's actually a synthetic estrogen. It's not an estrogen that's normally occurring. The reason that it's used in contraceptive pills is that this synthetic part of it, this little extra chemical group on the drug, makes it very potent. It makes it so that the drug is really good at making birth control work better. So you can miss a pill if you're on an ethinyl estradiol birth control pill and usually not be at high risk of pregnancy. Whereas if you're on a birth control, that the older kinds of birth control, which are progesterone only, those, if you miss them, you really, if you're 24 hours or greater from your pill, you're at much higher risk of pregnancy because ovulation happens more easily if you don't have a potent estrogen on board. The other thing that's nice about ethinyl estradiol is it prevents breakthrough spotting. It stabilizes the lining of the uterus, which is what's shed during menstruation periods. And so it means that if you're on a birth control pill with ethinyl estradiol, you're less likely to have spotting. Those are the good things about that kind of medication. The downside about ethinyl estradiol is it is really good if you take it orally at signaling to the liver that there's a lot of hormone that's very potent present, and that causes the liver to create a protein called sex hormone binding globulin. Sex hormone binding globulin is a protein that binds hormone, which is a natural response of the body to excess hormone being present or very potent hormone being present. The downside of that is that it can be better, that protein can be better at binding the hormone than the cells of the vestibule. The vestibule is this ring of tissue right around the opening of the vagina. It's really important for lubrication and comfort during sex. And if it doesn't have enough hormone, it can cause sex to be painful. People will describe like a scratchy sandpaper feeling. So that can happen to people who are on birth control pills with ethinyl estradiol. It can also happen to people who just have less estrogen present because of things like menopause. So that's a downside of ethinyl estradiol. Another downside of ethinyl estradiol is when you take it orally or transdermally through the skin in a patch form, it can cause the liver to produce a lot more clotting factors. And the problem with clotting factors is that they can cause you to have blood clots in your leg or lungs or even stroke. So if you're a person who is predisposed to blood clots, like maybe you have a genetic risk or you have a medical condition like lupus where you're at high risk for blood clots, then a medication with ethinyl estradiol, particularly an oral medication, is not a good idea. You can do some things if you're on ethinyl estradiol and don't have a medical condition to prevent blood clots, like maybe if you're on a long plane ride, maybe making sure you get up periodically to walk around to prevent blood clots. But generally, it is a medication that has a slight increase in risk of blood clots. And so that is the synthetic estrogen, and that's why it's the most common estrogen that you'll encounter in drugs. But there are other kinds of estrogen. There are four natural kinds of estrogen. There's estrone, which is made by the adrenal glands. It's not a super potent estrogen. It's not going to grow the lining of the uterus substantially. It's not going to do as much in terms of sexual function, but it is present in the body and can be converted to estradiol. Estradiol is the most common type of estrogen found in the body in women of reproductive age, people of reproductive age that have ovaries. Estrogen in the form of estradiol is super important for sexual function, like we just talked about, and it's also important for growing the lining of the uterus in preparation for pregnancy in people who are of reproductive age. So that estradiol is the most common type of hormone that we use generally in hormone replacement therapy. Hormone replacement therapy for hot flashes in menopause or for patients who want to protect their bone health it can be really a great drug. And the nice thing is that if you use estradiol through the skin, it does very little to cause things like blood clots, unlike ethinyl estradiol. The other thing that's nice is when it's through the skin, it doesn't have that same effect on sex hormone binding globulin. So you don't have the sexual side effects that you would have if you're using the more potent ethinyl estradiol, which is synthetic. So estradiol, great drug, naturally occurring estrogen. It's also the most commonly applied topical medication for people who are having genitourinary syndrome of menopause. So they have pain in the vestibule related to lack of estradiol throughout their body. And so just applying a small amount of topical estradiol can be really helpful. And it doesn't even go throughout the body. So for people who have like a history of breast cancer or other sort of hormonal concerns, or just don't want to use estrogen throughout their body, it can be a reasonable option. Other forms of estrogen that can be found throughout the body, there's Estretrol, which is another form of estrogen that is really only seen, actually made by fetal liver. So it's an estrogen that doesn't occur really in adults unless that adult is pregnant and the fetal liver in their pregnancy is producing Estriol, and then you can detect it in their urine. And but it is an estradiol that has some potency, and it can be used in some forms of birth control pills. The other estrogen that's naturally occurring is estriol, and that one is only present in pregnancy. So it is made by the placenta, and it helps to support pregnancy, and it doesn't happen in people who aren't pregnant, but it's a lot less potent. So when you talk about estradiol, the normally occurring estrogen that supports sort of normal function, versus estriol is a lot less potent. It's less likely to grow the lining of the uterus or stabilize it, and it's less likely to help if you have pain in the vestibule. But sometimes people who use estradiol topically for genitourinary syndrome of menopause experience a lot of stinging. And so moving down to something that's lower potency like estriol can actually be more comfortable. And so sometimes we will use it topically to treat people who have hormonal issues at the vestibule because it's more comfortable for them and they can tolerate it so that their tissue improves, and then maybe we can bump them up to topical estradiol. So anyway, that is a rundown, a little bit of a long rundown on different kinds of estrogen. I hope this is helpful. Love to hear questions in the comments, and just hope you're having a great day and getting through the holiday season okay.